In nuclear and fascicular fourth nerve palsy, we can get bilateral excyclotorsion of the eyes. So how would we evaluate that? We can measure this by placing a red Maddox rod vertically over the right eye and a white Maddox rod with a little bit of base down prism in front of the left eye, again with the rods oriented vertically. When we place the base down prism in front of the left eye's target is projected above that of the right eye. We now take the pen light and hold it down and in, which is the maximum field of action for those superior oblique muscles. The patient will see a red streak and a white streak. We ask the patient to tell us how these two lines are oriented with respect to each other, and if they have this bilateral excyclotorsion, those two line targets will not appear to be horizontally parallel. We then ask the patient to rotate the Maddox rods in order to make those two lines appear to be horizontally parallel. A patient with bilateral excyclotorsion will move the Maddox rods so that the cylinder axes are oriented about 5 to 15 degrees off of the 90-degree orientation as demonstrated in this photograph. So again, when the Maddox rods are oriented perfectly vertically, the patient will see the lines oriented as shown here on the left. And now the patient is going to rotate the Maddox rods, and when the rods are oriented as shown in this photograph, the patient now sees the two lines in their projected appearance as shown here on the right. So when the Maddox rods are oriented vertically, why does the patient see the lines oriented like this? Let me give you another slide to demonstrate that. So here we have the right eye's retina as you, the doctor, would see it, and here we have the left eye's retina. Now, unfortunately, the retinas do not come with these horizontal meridians demarcated for us, but again, if the right eye is excyclo-rotated, instead of the horizontal meridian being oriented horizontally, it's oriented like this. And similar is what happens to the left eye. So if a horizontal line is projected onto the right eye, the nasal aspect is going to be projecting from the temporal aspect of the target, and this part of the image on the retina is coming from the nasal aspect of the target out there in space. So because this target is landing above the eye's true horizontal meridian, it's going to be projected into space inferiorly, and because this part of the line is landing on an inferior aspect of the retina, it's going to be projected superiorly. So again, the temporal aspect of the target is being projected here. So the temporal aspect of the right eye's target is going to be appearing above the nasal aspect of the right eye's target, and that's shown for us down here. So again, if you can ignore for a second what's going on over here, this is the right eye's image from the patient's point of view. And so if the patient is projecting out into space, this would be the nasal aspect and this would be the temporal aspect. And that is why the patient sees the horizontal red line as appearing not horizontally parallel to the plane of the floor. So the temporal aspect of the right eye's target is going to be appearing above the right eye's nasal aspect of the percept. And similarly, you can walk through the explanation for why the left eye sees a horizontally projected white line as appearing superiorly oriented temporally compared to the nasal aspect of the left eye's line.